Okay, here we have a lateral view of the facial bones. Going to focus a little bit on the teeth here. Um, the anatomy. So if you look at an individual tooth here, you can see the roots, high density portion that covers the top of the tooth is the enamel, high density, slightly less dense, okay, dentin, around like this. Then you see like an H-shaped lucency in the tooth. Okay, that represents this is the pulp chamber here. Pulp chamber contains nerves, vasculature, comes through the inferior. Here you can see this is the inferior alveolar nerve canal, which runs through the mandible. Okay, comes up like this, and then supplies the vasculature to the roots of the tooth. So if you have a cavity in a tooth, it'll appear as like a radiolucency. Superficial cavities, they may be treated with a filling. Okay, usually if you have a lucency, a cavity that extends into the pulp chamber, this more problematic. Apparently, the dentist will like to offer root canal or an extraction once you have a carious lesion that gets that. Do the sinuses a little bit. Here you can see the sphenoid sinus like this. Here's the cell of turcica right here. Sphenoid sinus, the ethmoid air cells are in front of the sphenoid sinus. Frontal sinus like this. Maxillary sinus of the hard palate. So if you have a cavity here at the root, one of these upper molars, that because of the protrusion of that into the hard palate adjacent to the maxillary sinus, you can get odontogenic sinusitis. Here you can see the mastoid air cells.